arngut kinong pang COVID bakunthop uwei ophisar jongka Geological Survey of India but uwei pat shipai BSF Khlad no nekamiet ha North Eastern Indira Gandhi Institute Health and Medical Science Negrims ha bapentikna ekani u director katnat jongka koi kakhiau Dr. Amanwar ulong babaro arngut Khlad no nakadau COVID hakaba uwei naki ulakhlad hakapor sibiji teng step uwei pat hadian arkanta u director lai thu ru ba yote officer BSF brang south system krta natura la pha sa COVID ICU jongka negrims hadian bolayo yote virus bat pau kadak sitom lai thu ru ba uwei pat unong pang ubade ubadang life snem krta ubalawan bansha pu hanre hadian la pau bo yo yote virus yote nong pang labu la ka jongka kamra bat haba ka jingsitom ka nangjur lara u sa COVID ICU yakate ke jingklat jingkitei ki arngut la pentignaru da director katran ka koi kya Dr. Amanwar kumbalong mentah ki nong pang COVID ki blaklat hameglia ki la poisa ngut ki bakun thup yu trai ka betini hospital bat iwe pat ikhulong ibadang khnai banai.
Okay. The two persons who had passed away at Negrims, who were admitted at Negrims, and as per the records, as per the report from Negrims, one is Shri Banteilang R Syngai. He is from Lalsharai, the Bhoi District, and another one is Nanseshwar Deury. He is from BSF. I will read out the summary of Banteilang R Syngai. The patient was admitted at Negrims on 5th July 2020 with complaints of pain in the right upper quadrant of the abdomen. He had just returned from Kolkata on that day and was in a quarantine facility prior to transfer to Negrims. He was transferred to Negrims on 5th of July 2020 itself when he had complained of pain, abdomen inside the quarantine center. On evaluation here in Negrims, he was diagnosed as a case of acute calculus cholecystitis. His sample was also taken for RT-PCR, which was positive for COVID-19. He was shifted to the COVID isolation ward and was conservatively managed. During his course of stay, he developed diarrhea and acute kidney injury and was transferred to the COVID ICU for further management. His two samples on 16th and 17th July were negative. Prior to him being taken to ICU, 16th and 17th July, he was all right. His samples also have tested negative. He, however, developed sudden onset respiratory failure on the 18th of July 2020. He was initially managed on non-invasive ventilation but did not improve and was subsequently intubated. His respiratory failure worsened and he developed respiratory and cardiac arrest on 18 July 2020. CPR was given accordingly, but he could not be revived and was declared dead at 23:56 hours, 11:56 p.m. The immediate cause of death is type 1 respiratory failure with acute kidney injury. The antecedent cause is COVID-19, and the contributing causes is acute calculus cholecystitis. Summary of Nanseshwar Deury. He is a contact at Umpling BSF campus. On 1st of July 2020, and as a high-risk case, he was put under quarantine, and when they had done the RT-PCR, it turned out to be positive. He was placed in the composite hospital, and on 12th of July 2020, he was referred to civil hospital because of certain complaints which points out to complications of COVID-19. And from civil hospital, they had referred to Negrims on 13th of July 2020. This was the particular patient which I had mentioned, who was very serious and he was critical. The patient had a history of contact with a laboratory confirmed case of COVID-19. He developed symptoms suggestive of COVID-19 and was tested on the 4th of July, where it came out as positive. He was also a known case of type 2 diabetes. He was initially managed at BSF Composite Hospital, Umpeling, but was referred to civil hospital in view of worsening breathlessness and persistent cough. He was then transferred to Negrams on 13th July 2020 in view of need for ICU care due to worsening symptoms. On arrival in Negrams, he was managed in the COVID ICU. He was in acute respiratory distress syndrome with severe sepsis and multi-organ failure. He did not improve with treatment. He developed respiratory and cardiac failure, which did not improve with resuscitative efforts and expired on 19th July 2020 at 2 a.m. The immediate cause of death is type 1 respiratory failure with multi-organ dysfunction syndrome. Antecedent cause is COVID-19 and acute respiratory distress syndrome. Contributing causes is type 2 diabetes mellitus. The name of this patient is Nanseshwar Deury. He is a Jawan of the BSF.